Listen to me very carefully right now. Because what I am about to tell you could easily save you thousands, and I mean thousands, of dollars of your hard-earned retirement money. Are you turning 65 soon? Are you already retired? Or maybe you retired a few years ago, looked at Medicare, got completely overwhelmed, and said, "I'm healthy, I don't need this right now, I'll deal with it later." If that sounds like you, I need you to sit down, grab a pen, and pay absolute, undivided attention. Because dealing with it later in the world of Medicare is one of the single biggest financial landmines you can step on in your golden years. People come to me all the time, and they say, "Susie, I missed my window to sign up for Medicare. What do I do? Am I completely uninsured forever?" No, you are not uninsured forever. But you have stumbled right into what the government calls the Medicare General Enrollment Period. Now, I want you to understand what this period is, why it exists, how it works, and most importantly, the massive financial penalty hiding behind it if you aren't careful. Let's break down the problem first. When you turn 65, the government gives you what is called an initial enrollment period. It lasts for 7 months, the 3 months before the month you turn 65, your birthday month, and the 3 months after. That is your primary window to sign up for Medicare Part A and Part B. If you are still working at 65 and you have qualifying insurance through your employer or your spouse's employer, you get a pass. You get what's called a special enrollment period when that job or coverage ends. But what if you weren't working? What if you dropped your job, didn't have employer coverage, and just forgot? Or what if you thought COBRA counted as active employer coverage? Newsflash, COBRA does not count as active employment coverage for Medicare. So you missed your window. The door slammed shut. What happens now? You can't just call up Medicare in August or October and say, "Hey, sign me up." They will tell you no. You are locked out. And that brings us to the fear that keeps so many pre-retirees up at night. What happens if I get sick while I'm waiting? And how much is this mistake going to cost me? This is where the general enrollment period comes in. Every single year, from January 1st through March 31st, the government opens up the general enrollment period. This window is specifically designed for people who miss their initial enrollment period and do not qualify for a special enrollment period. If you apply during January, February, or March, your coverage takes effect on the first day of the month after you sign up. If you sign up in January, your coverage starts February 1st. If you wait until March 31st, your coverage starts April 1st. That sounds simple enough, right? You think, okay, Susie, so I missed my deadline, I wait until January, I sign up, and I'm fine. Wrong. You are not fine, because Medicare is going to hit you with a late enrollment penalty. And this isn't a one-time $50 parking ticket, people. This is a monthly penalty that gets added to your Medicare Part B premium for the rest of your natural life. Let me repeat that so it sinks into your brain, for life. How does the math work? For every full 12-month period that you were eligible for Medicare Part B but didn't sign up, your Part B premium goes up by 10%. If you delayed signing up for 2 full years, 24 months, you are slapped with a 20% penalty on top of the standard Part B premium. Every single month. Year after year. Decade after decade. As the base Part B premium goes up with inflation over time, your 20% penalty dollars go up with it. You are bleeding money needlessly out of your retirement accounts. And don't forget about Medicare Part D, your prescription drug coverage. If you go without creditable prescription coverage for 63 days or more after your initial window closes, you get hit with a lifetime Part D penalty too. Why does the government do this? Because insurance only works when healthy people pay into the pool alongside sick people. If everyone waited until they got a scary diagnosis at age 68 to sign up for Medicare, the whole system would collapse. So the government uses these penalties as a hammer to make sure you sign up when you are supposed to. So, what is the actionable takeaway here? What do you need to do right now to stand in your truth, protect your money, and secure your health care? Number 1. Audit your current enrollment status immediately. If you are turning 65 soon, write your 7-month initial enrollment period down on your calendar in bright red ink. Do not rely on your memory. If you are past 65 and relying on COBRA, retiree health plans, or individual marketplace coverage, understand right now that those do not protect you from Part B late penalties. Contact Social Security today to verify if your coverage is considered creditable by Medicare standards. Number 2. If you missed your initial window, mark January 1st on your calendar. The moment the general enrollment period opens on January 1st, submit your application for Medicare Part A and Part B. Do not wait until March 30th. The sooner you enroll between January and March, the sooner your coverage kicks in on the 1st of the following month, reducing the gap where you are sitting completely uninsured and vulnerable to financial ruin from a sudden medical emergency. Number 3. Sign up for Part D at the exact same time. When you enroll in Medicare Part B during the general enrollment period, you get a special enrollment period to sign up for a Part D prescription drug plan. Do not skip Part D just because you aren't taking any expensive prescription medications today. If you skip it, that Part D penalty clock keeps ticking. Buy a low-cost, basic Part D plan to lock in your coverage and stop the penalties from compounding. Number 4. Face the truth about penalties. If you owe a penalty, accept it, budget for it, and move on. Do not let fear or anger cause you to delay enrolling even longer out of spite. Every year you delay adds another 10% to your lifetime Part B cost. Stop the bleeding today. Retirement is meant to be a time of freedom, joy, and peace of mind. You worked 40 or 50 years to earn this peace. Do not let a missed administrative deadline or a lack of planning wipe out your savings and ruin your financial security. Know your dates, take control of your healthcare, and protect your money.